Welcome to Step 7, the final step in our journey to brain health, managing chronic illness. Did you know that nearly half of adults in America live with a chronic illness? These are conditions that persist for more than 3 months and can't be cured with vaccines or medication. Diabetes, heart disease, cancer, stroke, obesity, and hypertension all fall in this category. While it may seem that these chronic illnesses only affect specific parts of the body, these conditions can also impact brain health through the brain-body connection. Your brain works with many of your body's systems in different ways, so if something goes wrong with one organ system, your brain might struggle too. But research shows that actively managing these conditions can reduce their negative effects on the brain. Let's start with the cardiovascular system, which circulates blood throughout your body. Your brain needs a significant amount of blood to get the nutrients and oxygen it needs to function. Chronic cardiovascular diseases like hypertension and atherosclerosis can reduce blood flow to the brain, leading to less fuel to the brain, which can negatively affect cognitive function. Chronic undersupply of blood can even cause structural damage to the brain, especially in white matter, increasing the risk of vascular dementia. That's why maintaining a healthy cardiovascular system through exercise is so important. Unlike the heart, the connection between the liver and the brain isn't always obvious, but can be just as important. Most of us know that the liver filters blood and removes toxins, but what happens in the liver doesn't just stay there. It can affect your brain as well. The liver acts as a power engine for your body's metabolism, and because your brain needs 20% of your body's energy to function properly, having a healthy liver is crucial. The liver also removes the toxins that build up from these metabolic processes, as well as those ingested from alcohol or unhealthy foods. If your liver isn't working properly, these toxins can build up and enter your brain, causing harm. So, speak to your primary care provider about routine liver function tests and adopt a healthy diet and lifestyle to reduce the burden on your liver. Vision and hearing loss have recently been added to the list of modifiable risk factors for dementia. Lack of sensory input might lead to the loss of brain volume and accelerate cognitive decline. Vision and hearing loss can make social interaction more difficult, leading to social isolation, a known risk factor for dementia. However, research has found that using hearing aids and getting treatment for vision loss can significantly lower that risk. So, it's essential to check with your doctor as soon as possible if you notice any changes in your vision or hearing, and be sure to keep your prescriptions up to date. A common feature of many chronic illnesses is persistent low-grade inflammation. Chronic inflammation can stiffen your blood vessels, and inflammatory molecules can enter the brain and cause damage that increases the risk for stroke or dementia. How can we keep our brain healthy if we are living with a chronic illness? In short, keeping your brain in good condition involves taking care of your entire body. Adopt a healthy lifestyle with a diet rich in fruits and vegetables, whole grains and lean proteins, while limiting processed meats, sugary foods, and salt. Refrain from alcohol and smoking, and make sure you get enough exercise and sleep. Follow your doctor's guidelines and take prescribed medications as directed. Regular physical checkups can catch early signs of these conditions. Discuss any changes in your physical condition with your doctor to adjust your treatment plan if necessary. If side effects from medications are a concern, talk with your doctor about alternatives or dosage adjustments. Some medications can impact cognitive function, so be sure to discuss this with your healthcare provider. Also, make sure your doctor knows about all the medications and supplements you're taking to avoid drug interactions. Finally, consider joining a self or group management program for chronic illness to learn strategies for actively managing your condition. Check out our previous videos on other steps to brain health. For more information and to read up on the evidence, visit cognitivevitality.org.